watching The Fix with me, Karima Brown. Now, the transit camp in Strandfontein in the Western Cape, set up to house homeless people, has been under the spotlight for all the wrong reasons. Doctors Without Borders have slammed the conditions in the camp, and activists and media organizations have also raised alarm bells around the treatment of homeless people at the camp. To tell us what the reality is at the camp, I'm joined now via Skype from Cape Town by independent monitor Tariq Jenkins, who have documented the conditions there. Tariq, good morning. Thank you so much for joining us. I'm sitting with a statement from the City of Cape Town by the Mayoral Committee for Community Services and Health, Mr. Zahid, Councillor Zahid Badruddin. Essentially the statement is saying that there's been a lot of debate to the site, and the city wishes to reiterate that while the sports complex is a public facility, it is currently being used as a shelter as part of the national efforts to contain the spread of COVID-19. And they're essentially saying that they are dealing with the issues, and they had challenges, but they are improving the conditions there. You've documented the conditions. You've spoken to homeless people. Paint a picture for us of what you have found and what is in your report.
So in my report, which is actually part of a joint combined submission from an independent group of specialists that is in Human Rights Commission to comment and assess on the situation. We were on site last week, Saturday and Sunday, and I've been on site pretty much every day this week. I think what part of our report is really to look at the concerns, especially the human rights violations and the reports of inadequate conditions and design. My report speaks to the specific choice of the architectural design of this facility, which is modeled more on an incarceration design than it is in as far as a medical health facility. When one enters into the site, each tent has a fence around it, and guarded at that fence is a private security company, and then behind the private security company is law enforcement. And as one moves out into the larger space, there is a palisaded wall. So in effect, the occupants that are living there are restricted from moving out unless they are ill or sick, and then they are then accompanied or stretchered to the health unit, which is on the side. One of our concerns, of course, was the fact that we, on Saturday, would move into these tents, which housed as much as 500 to 600 people. There was no social distancing. In fact, at that stage, people were sleeping on top of one another. And the ventilation in the large tents do not meet the minimum requirements of say, even for, tuberculosis. And we are very concerned about the fact that the tents themselves and the manner around which the camp was being administered was more of an incubator for COVID than necessarily a place that is designed to stop the spread of COVID.
Mr. Jenkins, let me come in here quickly. You state that in your report that approximately 1,500 people are housed in this facility. When you were compiling this report, you said that only 11 out of that 1,500 people have actually been tested for COVID-19. Did you get an explanation from the authorities on why the testing is so low, considering that the health department is rolling out mass screening and testing at other facilities? And this is obviously a vulnerable group. A lot of these people have comorbidity, risks. They are people who suffer from alcoholism. These are people who are drug addicts and other diseases such as tuberculosis and HIV. Why is there no mass screening and testing happening at this camp? Can you tell us?
I think you've really put the pin on exactly what I think the primary concern is. Our understanding of the lockdown that was announced by President Cyril Ramaphosa was really around the stop and the prevention of the spread of COVID. It is inexplicable to understand that in a situation like this there has been so few testing. In fact, one of our major concerns, and this was a concern that was put forth by Doctors Without Borders, MSF, who have not been able to access the actual medical reports. We continuously try to get a breakdown of the exact number of who's actually being tested, how many are in quarantine, how many are in isolation, and in particular if anyone has tested positive. At that time, Saturday and Sunday, the figures that we were getting was that 11 or 13 were tested, and no one has tested positive. However, in a conversation with Dr. Badruddin I had myself in person, he said that roughly there were 53 people now that have been tested, but we don't know the number of who has tested positive, and we don't know how recent that batch of testing has been. So it does seem that there is an acceleration of testing that's happening at the site. However, I think it's important to point out the fact that a screening process at this point, given the fact that the medical opinion on COVID has shifted, is insufficient. It is now quite common knowledge that asymptomatic carriers are of a large percentage of transmitters of COVID, which means that if one really wants to get a sense of what the COVID statistic is like on the site, and if the site in fact does not have COVID, everybody would have to be tested. I think a precedent here was set in Port Elizabeth at the female prison when one of the warders was tested positive for COVID, and as such the state ordered 236 inmates plus about 240 staff members to be tested, and I think a similar kind of rollout would have to happen here.
Absolutely. Now, in your report, you also say that hygiene is a serious problem at the camp. Floors are not being scrubbed with detergents. There's no toothbrushes. And also, when you were there, there was a lot of dampness due to the heavy nights of rain. And there's also a shortage of hot water. Another issue that was raised, and I read through your transcripts of interviews with homeless individuals, many of these individuals believe that they were in fact coerced to give up their regular spaces that they had on the road, whether it is in Mowbray in Cape Town or in Makassar, and they were essentially threatened that if they don't go to this camp, they will be arrested. What exactly were you able to verify, apart from these individuals that you've spoken to, that this was indeed the case?
Yes, I think part of the report is also to demonstrate the range of violations that had happened along the journey to Strandfontein. The street-based people that we've interviewed, and according to their testimonies, there were reoccurring promises that have been identified. It seems that
Hi, Mr. Jenkins, are you with us?
By social workers and by CID. Yes?
Do continue, sir.
Can you hear me?
Yes, I can.
So it seems that a lot of the street-based people were either coerced, forced into vans to go to Strandfontein, to the collection points, then to Strandfontein, or were also hoodwinked into acquiescence by a range of promises that were given to them by social workers and by members and employees of the CIDs in particular, and law enforcement. These would include that they would be tested for C19, that they would have a mattress and an individual tent, that they would be appropriately distanced from each other, that they would have 3 meals a day, a hot shower, and soap.
Now, Mr. Jenkins, let me just come in here. The city, in their response, has said that post-screening they have enrolled 846 persons onto a chronic and clinical care program. They also say every person who has come onto the site has been screened for COVID-19, as well as TB and other chronic conditions. They say that they've got dozens of positive TB cases and no confirmed cases of COVID. Now, does that correlate with the data that you collected?
There needs to be a difference. We need to understand the difference between screening and testing. Screening, basically in this case, would screen you for the symptoms of COVID. A test would test you whether you have COVID or not. And a screening would be the process that would happen before you would normally, let's say, qualify for a test. But as we've determined now that the health opinion and medical opinion currently will tell us that asymptomatic carriers are the largest transmitters of COVID, which means that in this particular situation, while screening is important in order for us to get a sense of general health of the individuals that are moving into the camp, in particular for the prevention and the assessment of COVID, testing is absolutely essential.
Now,
and so,
let me come in here quickly. There's been a lot of focus on this camp. Media has been prevented from coming in. The city said no, they're locking this place down and they're having to restrict access because they have to safeguard the individuals. Now, you can't have an argument with that, but we have seen reports where the city has almost wanted to choreograph the access of the media. Are you concerned as an independent monitor and as someone who's documented violations that has gone to the Human Rights Commission that a lack of media access is going to lead to a lack of accountability on the part of the city's officials?
Yes, I am. In fact, I think it's not just a question of the lack of media, but it's a question that officials in their own official capacity, such as councillors, etc., are also being prevented from accessing the site. I understand the concern about the politicizing of what is happening, and there is a fear that the site will be used as political fodder. But one thing has to be very clear, and I think this is an articulated message in a way that the city, I think, should really consider a deepening of its own understanding, is the fact that in these interviews that we've had with the occupants, they themselves describe the place that they're in, using the terms concentration camp.
All right, Mr. Jenkins, we've run out of time. My apologies. This is obviously something that we will keep on watching. Thank you so much for joining us. Well, you've had your fix for the week. Thank you so much for watching. See you again next Sunday.